inflammatory breast cancer remains a very aggressive kind of cancer. And despite all we need to do in terms of early initial therapy with neoadjuvant approach, using chemotherapy and surgery and radiation, women do live only for a shorter period of time. The overall survival remains really limited, and the biology of the disease is still something that we're learning more and more about. And a lot more needs to be done so that we can identify better novel targeted strategies in an attempt to improve the outcome for these patients. So a few of these pathways have already been approached, and most of them are the ones that have been used for breast cancer overall. The problem here is most of the data that we have has been extrapolated from larger studies in breast cancer where a few IBC patients were also enrolled. So we really don't have dedicated IBC patients and dedicated IBC trials to come up with novel pathways. But a few things that we've now understood about the biology has brought up pathways that we now understand a little better that are activated in this disease. And these pathways include the PI3K/AKT/mTOR pathway, which not only is activated in many cancers, including breast cancer, but is also activated in cell lines with inflammatory breast cancer and xenograft models. Intertwined and interlinked or connected to this pathway is the pathway with the cytokines. So surrounding tumor tissue, the tumor-associated macrophages, chemokines from the pathway or from the cancer itself recruits these cells and then get activated into what we call tumor-associated macrophages. And these then cause activation of cytokines like IL-6 and IL-8, leading to upregulation of another pathway called the JAK-STAT pathway, which ultimately leads to cell proliferation and survival. And there was recent data that was published in animal models, specifically triple-negative breast cancer animal models, that if you inhibit the PI3K/AKT/mTOR pathway, there is upregulation of the IL-8 and the JAK-STAT pathway. And so if you use dual inhibition for both these pathways, you are actually creating better overall survival in these animal models and reducing the tumor sizes.